Hi, and welcome to We Love Anatomy. I'm Dr. Heather.
And I'm Dr. Melanie, and this is our skeleton friend, Walter.
Today we are going to talk about anatomical terms as they relate to the body, anatomical directions, and positions. It's very important that we always relate to the body in the same way, and that's why we have this special language called anatomical or medical terminology. The first thing we want to talk about today is anatomical position. So Walter is basically in anatomical position right now, but the way that we do that is standing straight up with your palms facing forward. Now, you can see that my thumb is away from my body and my pinky fingers are toward my body, so this is how you always want to describe your patient, whether they are laying on their side or anything. If you are describing something happening in their body, this is the position that you will be referencing. That way we always know that everybody is speaking the same language and referencing the same points.
Next, we're going to take you on a little tour of the regional anatomy that describes the cranium or the head and the face. So we're going to do a little bit of a close-up shot here on Walter. When we talk about cranial, we talked about directions early in one of our videos, and the cranial direction is up towards the top, and this is the skull cap here for Walter. That is his cranium. Now we're going to move inferiorly a little bit, and we're going to see that the eye area is also known as the optic or orbital area for Walter. So if someone has, like, say, allergies and they get swelling just beneath the eyes, I might say that Walter has suborbital swelling, sub meaning below the orbit. Next, we're going to look at Walter's mouth. So here, this is the oral area or the orus. So if there's a rash around the mouth, like we sometimes see with babies and sometimes adults too, we might call that a perioral rash. Peri meaning around. So you'd know that that was around the mouth. Next, we're going to look at the nasus or the nose. So if somebody has nasal congestion or it's in the nasal area, we're going to know that that congestion is the nose, related to the nose. Now I'm going to take Walter to his side, and we're going to look at the orus or otic area. So that refers to, if Walter was a real live person right now, we'd be looking at his ear. So if somebody gets auricular acupuncture, they're getting needles put in their ear. If someone has an ear infection and gets prescribed drops for the infection, we might say we're giving them otic drops. So those are some terms that you will see and want to lock into the memory.
Chin.
Very last but not least, we'll be talking about the mental area. Anytime you see mental in anatomy and physiology terminology, you're going to be thinking about the chin. If we have something happening or like a lesion beneath the chin, you would say it's a submental abrasion if somebody scratched there. Sub meaning below, submental, below the chin. So that is some of the superficial anatomy of the head that you might come across in your studies and practice.
All right, now we're going to turn Walter around and we're going to look at the spine. So the spine is going to extend from the skull down to the tail. So the base of the skull here is called the occiput or the occipital bone. Below that, we have the cervical spine, which is the neck. So the cervical spine extends from the base of the occiput to the top of the shoulders here. We have 7 cervical vertebrae, and pain in this area would be indicated as cervicalgia. Next, we have the thoracic spine, which is from the top of the shoulders to the base of the ribs. There are 12 thoracic vertebrae and 12 pairs of ribs on either side. Below the thoracic region, we have the lumbar spine. The lumbar spine has 5 lumbar vertebrae, and pain in this region would be called lumbago. Below the lumbar spine, we have the sacrum. The sacrum was originally 5 different segments that have all fused together into one larger bone. And just below the sacrum, we have this teeny tiny bone called the coccyx. If you were to fall and break the coccyx or bruise it, pain in this region is called coccydynia. Next, we're going to turn them around again, and we're going to look at the upper extremity. So looking at the upper extremity, first we're going to look at the axilla. So the axilla is the armpit. So what we would say here is the armpit is the axilla. The axilla is important if we are placing EKG leads. Then we would use the anterior axillary line or the mid-axillary line for placement of some of our electrodes. There are also lymph nodes in the axilla that are a pretty common metastasis site for breast cancer, so we always want to be assessing those lymph nodes on physical exam. So that's our axilla. Now, a lot of times we think of the arm as this entire extremity. And when we say extremity, the upper extremity is the arm and the lower extremity is the leg. So the anatomical term of the arm actually is indicative of this upper arm, the region of the humerus bone. So from the shoulder to the elbow is the arm, also known as the brachium. The lower part of the arm, the forearm, is called the antebrachium. So from the elbow to the wrist is antebrachium. So we have arm, forearm, or brachium, antebrachium. Next, we have the carpal region. So if we are looking at these 8 little bones here that make up the wrist, those are the carpal bones. Therefore, the wrist is called the carpal region. When we look at the hand, we have the thumb, which is called the pollex, and then the fingers, which are called the phalanges or the digits. So we can say phalangeal or digital in relation to the fingers. Last, if we are in anatomical position, we are looking at the palm or the palmar surface of the hand. And the posterior, if we turn our hand around, that posterior surface is called the dorsum or the dorsal surface of the hand.
So next, I will take us on a tour of the lower extremity, and we're very lucky today because Walter is much more flexible than any one of us here. So we'll be able to show you in a little bit more detail the regions that are associated with the lower extremity. Now, the first bone that I'm holding here with my left hand is the femur. So this on the body is referred to as the femoral region. It's also known as the thigh. Now, oftentimes people will mistakenly, when they're referencing their leg, point to this part of the lower extremity and call that the leg. But in truth, the leg, the actual anatomical leg, is comprised of the tibia and the fibula, these lower, more inferior parts or distal parts of the lower extremity. So we have our femoral area in the thigh, and then we have our leg here, inferior to that. When we talk about the foot is also known, it's referred to as pedal or pedal. So if somebody has swelling in the foot, for example, you might say they have pedal edema, or if they have it in both feet, you might say they have bipedal edema. So those are terms that you will see in medical charts. Next, let's talk about a couple other areas. We have the tarsal area of the foot, which is comprised of these tarsal bones. And then, like we saw in the upper extremity where Dr. Heather described the pollex, here the large toe or the great toe is referred to as the hallux. And then, like we saw with the fingers of the upper extremity, we have digits or phalanges here. And then the next thing I want to show you is the 2 sides of the foot. So the top portion of the foot here is referred to as the dorsum of the foot, and then we have the plantar surface of the foot here. This is the part of the foot that touches the ground, and you'll see that clinically when someone complains of a wart on the bottom of the foot, very painful. They'll typically get diagnosed with plantar warts. So that's the lower extremity. Now we're going to take ourselves back to Walter's core here, and we're going to look first at Dr. Heather described the thoracic portion of the spine. The thorax itself is comprised of the area from the clavicle to the bottom of the rib cage. So this is our thoracic region of the body. The thorax is going to house both lungs, part of the esophagus, the heart, so very important, well-protected area of the body. But that's where we describe something that's going on between, again, the clavicle and the lower part of the ribs. The abdomen, on the other hand, is inferior to the lower rib, and everything superior to the pelvic bones here. So this is going to house our digestive organs, including the stomach, the intestines, the pancreas, the spleen, and posteriorly behind this we'll have the kidneys as well. Now, when we talk, a lot of times you'll see in your text things written as abdominopelvic cavity, and what that means is there's a continuum between the abdomen and the pelvis. The pelvis is comprised of the area that is housed here with the pelvic bones. So you'll see that the reproductive structures and bladder are going to be housed here. The other area that I'm going to point out to you is where these two pelvic bones come together. This is the pubis. The pubis is, where we have our pubic symphysis, or the coming together of those bones. This is a spot that'll get referenced, for example, when someone has a bladder infection. Oftentimes they'll have pain just above that pubic symphysis, and that's called suprapubic pain. So that gives you a little bit of a tour of the abdominal and pelvic areas of the body.
One other thing that we want to discuss here is the inguinal region, which is this region. There's an oblique line between these 2 points of the pelvic bone, and there's a ligament that runs here called the inguinal ligament. And this is an important region because there are a lot of hernias that occur in this area. Oftentimes with men, we'll end up with an inguinal hernia. So that is the inguinal region. Now we're going to discuss some directional terms. So let's see. I am going to turn Walter to the side here. So let's talk about terms of how to describe the body in terms of direction. So the first two terms that we're going to talk about are anterior and posterior. So anterior means toward the front side of the body, and posterior is toward this back side of the body. There are two other terms, ventral and dorsal, that mean a very similar thing. So ventral would be the front side of the body, dorsal would be the back side of the body. However, ventral and dorsal are used more with animal anatomy than human anatomy, though you will see it in reference to the spinal cord, where we have the ventral horn and the dorsal horn. We also want to talk about the top of the body versus the bottom of the body. So the top of the body is superior, meaning toward the head or toward the top, and then anything below that is inferior. So we use these for relational terms. So we can say that the head is superior to the thorax and the pelvis is inferior to the thorax. There are two other terms that are similar but a little different, which are cranial and caudal. So cranial means toward the head, and caudal means toward the tail. So caudal would have to end at the tailbone here. We would never use cranial or caudal in reference to the lower extremity. We also want to learn some terms for the extremities themselves. So these terms are proximal and distal. Proximal is closer to the attachment of the body, and distal is farther away from the attachment of the body. So the elbow is distal to the shoulder, so it's farther away from the body than the shoulder, but the elbow is proximal to the wrist, meaning it's closer to the body than the wrist. If we're looking at the lower extremity, the knee is distal to the hip, and the knee is proximal to the ankle. We also want to talk about lateral and medial. So I'm going to actually have you use that here and put that in the center. So right now, Dr. Melanie is showing you the midline of the body. So medial is closer to the midline of the body, and lateral is farther away from the midline of the body. So if we think about the organs of the thorax, we know that the heart is relatively central, slightly to the left, and the lungs are each lateral to the heart. One is on either side. So you can say the lung is lateral to the heart is medial to the lung. The last thing we're going to talk about is superficial and deep. So superficial means closer to the surface of the body. So our skin is the most superficial thing that we have. And then deep to that, we have the superficial fascia, which is a layer of connective tissue under the skin. Deep to that, we have the muscle. And then deep to that, we have the bone. So it's just talking about how close to the surface of the body is a structure. So it's in relation to one another. The skin is superficial, the bone is deep.
And next, we're going to talk about a couple of terms that you're really only going to use in two contexts. So these are going to be sectional terms. And so the first context is when you're learning anatomy and physiology, especially if you're doing any kind of dissection, and those of you with cadaver labs, you'll definitely be sectioning things. So we're going to talk to you about what those terms are so you'll be able to recognize them. The second context is you're going to be using them when you're looking at diagnostic imaging reports. So you might see these sections in a CAT scan, in an MRI, in an X-ray, and that's where you'll really learn to recognize them in context. And what those sections allow us to do is to really study how the organs are related to one another, how they're positioned relative to one another. So that's an important tool for, especially when we're examining disease and when we're first learning anatomy. So I'm going to use this bar, and Dr. Heather is going to assist me with that. We're going to start with a sagittal section. A sagittal section is going to divide the body into two parts, and we're going to be along a vertical line. So it's going to be a left part and a right part. So everything, we have a sagittal section that is splitting, Walter, as we see it. Now, where Dr. Heather has this bar right now is referencing a mid-sagittal section. And what that means is we have roughly divided Walter into a equal left and right half. When we move laterally, like Dr. Heather just did, we still have a sagittal section. We've still divided him into left and right, but on a vertical line. But what we've done here is we've created two unequal sides, an unequal left and right. So that's called a parasagittal section. And the term para refers to alongside. So that's what we've done, is we've made an unequal, left and right section. Now, the next type of section is referred to as a frontal or a coronal section. So if you do it to the head, you see a lot of like brain examinations looking at coronal sections. What that's doing is it's dividing Walter's cranium there into a anterior section and a posterior section. Okay, so again, it's along a vertical line, but we've got anterior and posterior. So that's again called a frontal section or a coronal section. And then last but not least, we are now making, you can see I have a horizontal line here, and this is a transverse section. And the transverse section, the purpose of it is to divide the structure into a superior portion and an inferior portion. So that can be anywhere. We have a superior and an inferior portion, but you see these quite a bit in MRI and CAT scan studies. We do have another video that's going to describe those and show you some examples of that, and we hope you'll have a chance to watch that. Otherwise, yes, we really appreciate you being here and supporting our channel and watching our videos. We hope you learned something. We hope you love anatomy as much as we love anatomy, and we look forward to seeing you on the next video. Take care.